Trauma is pervasive. And trauma, we have to understand, it's not just physical abuse, sexual abuse. It may be the death of a loved one. It may be divorce for children or adults. So there are many different events in someone's life that can be traumatic. And if we take all those type of events into account, then trauma, you can see, is very pervasive throughout our society. And in my opinion, if trauma is this pervasive, then trauma-informed care should be pervasive as well. As a child psychiatrist, we often see children that are traumatized by physical abuse, domestic violence. However, the parent that's bringing them in may also be traumatized by physical abuse, the same physical abuse and domestic violence. Therefore, we have to have trauma-informed care, not just for the patient, but for the entire family.
Anecdotally, it felt like there were probably, conservatively, 85–90% of the people we were seeing had trauma histories of one form or another, and it was kind of validating to start seeing the research that supported that it wasn't just my perception from a very narrow perspective, but truly the evidence supports that the vast majority of the people that we work with do have these trauma histories.
Trauma is relatively ubiquitous within our society. I don't think the general public recognizes the extent to which many individuals experience some form of trauma in their early life or as they mature into adulthood. And the important thing is to recognize that so that we can intervene and help ameliorate the effects of that trauma. And the reason intervention is so important is because now we know that trauma has a lot to do with not just a person's psychological health, but their physical health. So conditions like obesity, hypertension, heart disease can be traced back to early trauma experiences. So not just in the behavioral health world, but in the general medical world, it's critical that we realize how common trauma is, that we recognize it in our practices, and that we respond to that trauma in a way that minimizes the effect of that trauma. And then even as a last point, that we avoid re-victimizing and re-traumatizing those that we serve. The literature supports that our brains are often wired by our early experiences in the environment, and when those experiences are less than optimal, either related to abuse or neglect, or even caretakers that might be emotionally unavailable due to their own behavioral health conditions, I began to recognize how important that was in prognosis and in overall potential for adult health.
The nature of nursing really does lend itself well to providing trauma-informed services. Oftentimes we are the first contact that that individual may have, so it's really important that we have a strong grasp of these principles.
We try to always be cognizant of the fact that trauma is very likely in their background, particularly with child abuse. We know that that's intergenerational. So even if we're assessing the child, we know that when we interview the caregivers, oftentimes those caregivers will have a history of trauma. And so we have to go into those situations understanding that some of the reactions we get might not necessarily be because the person is necessarily trying to be difficult. Sometimes they are having a trauma reaction to our questions or to the setting related to something that's happened.
Trauma-informed care is really about a culture change. It's really about people recognizing and being aware and sensitive to the trauma that other people may have encountered.
If we're consistently trying to remind each other that we need to be dealing with the trauma, dealing with the aftermath of the trauma, not digging, not wounding people, but being sensitive to the fact that this may have informed the way they've learned to adapt, the way they've learned to function, their symptom set, allows us to help that person individually tailor the treatment that we're providing.
Trauma-informed care to me means recognizing a set of principles that is the culmination of a great deal of work in the healthcare world that recognizes the importance of early experience in overall health of individuals that we serve. So it's a culmination of brain science that says that our early experiences have a lot to do with how we function as adults in terms of our overall health. In my practice, the first thing that I do is, rather than say, "What's wrong with you?" now I've learned to say, "How did you get here?" or "What is your story?" Because many people come into my office for a reason because of a set of accumulated experiences, and it's very important to acknowledge that and set a stage for folks to engage around that.
While trauma-informed care often gets discussed as it pertains to the doctor-patient relationship. Actually, the relationships within our team and recognizing the potential for secondary trauma when we get involved in these difficult cases and can be traumatized ourselves just by nature of being involved.
The ACE study is a study that was conducted with the Center for Disease Control and a large managed care organization, Kaiser Permanente. Over a 10-year period, they looked at over 17,000 individuals. And they asked those individuals to what degree had they had trauma experiences. And first of all, what was startling was the large number of trauma experiences that each individual had. Many people reported 3 and 4 and 5 trauma experiences in their lives. But then as they tracked that number and looked at these individuals over time, what they noted was a direct relationship between their health and the number of adverse childhood experiences that they had. So conditions like depression, and individuals with 3 or 4 traumas had a 60% chance of experiencing depression. They looked at things like substance abuse risks. So individuals, it was directly correlated with the number of traumas and the likelihood an individual would be a substance abuser. But not just those behavioral health conditions. Heart disease, chronic obstructive pulmonary disease, asthma, hypertension, and obesity. And this study was again done in a primary care setting. But now what we have is evidence to suggest that preventing adverse child experiences will directly lead to a healthier population. And then if we can't prevent them, recognizing them early, and we now have evidence-based interventions to help individuals develop ways to cope with those traumas. And then thirdly, we make sure that we don't re-traumatize and re-victimize individuals that are under our care. So I think that it's critical that we recognize the importance of trauma and trauma experiences in our healthcare systems.
Nursing is about being person-centered rather than disease-focused. By having a good understanding of traumatic stress in our interactions with people, we can often get them to respond differently, not only to illness and injury, but also the way they emotionally respond and cope to the crisis situation at hand.
Patients that undergo trauma can sometimes be seen as the most difficult patients in a practice. And by discussing trauma and discussing trauma-informed care, you can really reduce the stress on yourself, the staff, and the patients, and really help with better outcomes because people can be more compliant. They won't avoid services as much. They won't misuse services as much. There's this sort of sensing that there's this pattern that, that came about with trauma, that it was really affecting the practice. And that, you know, with trauma, you were seeing the traumatic reactions to treatment. People were avoiding services that could really help them. They were not being compliant with things that could also help them, therapy, medications, procedures, etc. And those things were really harmful to our outcomes. We want to help people, and in order to help people, you really need to be aware of trauma and have trauma-informed care incorporated into your practice. The one thing is, I think first and foremost, as providers, we want to help people to the best of our ability. And I think you can get better outcomes with trauma-informed care. You can have better compliance, you can have less avoidance of services, you can have more proper use of services. And those things are all really important for us as doctors and mental health providers, physical health providers, nurses, dentists, anybody, because we want to help people. We got into the business to help others. I think the other thing is decreasing stress on staff, patients, and providers. I think that, you know, a lot of these patients, again, can be perceived as the most difficult patients. However, once you recognize trauma, learn how to deal with patients that have been through trauma, I believe that it will decrease stress on staff, and you actually will get a happier staff because of that, because they'll understand how to deal with these things.
The benefits of being trauma-informed are numerous. Several positive outcomes will ensue once you begin to incorporate these principles into your practice. You'll see things like a reduction in emotional and behavioral symptoms, decreased trauma symptoms, and reduce in substance use. You'll also see an improvement in functioning in the community and at school, an increase in the ability to build relationships, and finally an improvement in physical health and well-being, which is so important. So you can see with these outcomes that I just mentioned that being trauma-informed in your practice really does make good common sense.
One of the key differences is that I look for opportunities to give patients control back, and when you give them some control back and empower them and let them know that they're going to have choices in their care, then very often it makes the healthcare interaction more successful, and we're better able to treat individuals' primary conditions rather than treating symptoms.
I think it really helps us understand how to interact in difficult situations, how to sensitively ask questions about very personal issues when we're interviewing caregivers. The common sense nature of this in understanding how pervasive trauma is among all of us really made sense to me from the first time I heard it.
Nursing is really about providing comprehensive care. We attend to not only what is physically ailing the person, but also the psychosocial state of that person and the family members as well. So you can really see that there's a strong interplay to both physical health and behavioral health.
Trauma is pervasive.
It just made such common sense to me.
How did you get here, or what is your story?
Nursing and trauma-informed care principles have a strong correlation as both are person-centered and not disease-focused.
Trauma-informed care is really about a culture change.